So refractive lens exchange is the exact same procedure as cataract surgery. It's just performed a few years earlier in life. So whereas cataract surgery is performed once your lens has become cloudy inside the eye, usually in your 60s or early 70s, refractive lens exchange is performed before you've developed a significant cataract, but it's done proactively to give you the vision correction benefits and the maximized freedom from glasses and contacts that you would enjoy down the road, and to get that earlier in life. What we do is we make a very small 2mm incision in the front surface of the eye. We go in with an ultrasound probe. We use sound waves to break up the lens material, and then we inject a sophisticated lens that goes inside the eye where your natural lens used to be. This whole process takes about 7 minutes. Most patients are totally comfortable, have no pain during that process, and most patients see significantly better on day 1 after surgery, with continued improvement over the first 1 to 2 weeks after surgery. Most often when we're doing refractive lens exchange, we're using an adjustable lens technology called the light adjustable lens implant. This is a unique implant. It's actually the only implant on the market that's adjustable after surgery. So this lens goes inside the eye, we let you heal for a month, and then at a month we have the ability to come back and to make fine-tune adjustments based on what amount of correction is left over, and we get up to 3 adjustments to eliminate that leftover correction to give you the most precise and the sharpest outcome possible. During the time between your surgery and your adjustment treatments, we do have you wear some protective UV glasses that protect you from UV light coming into the eye, and that helps to maintain the integrity of your adjustable lens implant until all of your adjustments have been done. 24 hours after your final adjustment treatment, which is usually 6 or 7 weeks after the initial refractive lens exchange surgery, you're done with those glasses forever, and our goal is to get you 95% freedom from glasses. So the way that most people choose to do this is most people will choose to set your dominant eye for distance, your non-dominant eye for arm's length. Those two blend together to cover 95% of your visual demands. So everything from reading a text message to working on the computer to driving during the daytime, we would expect all of those things to be covered. The 5% of your day where you may still want a thin pair of glasses to fine-tune things could include nighttime driving. So at nighttime you may want a thin pair of glasses that brings your intermediate eye out to distance. Or vice versa, if you're going to sit down and read a book for an hour, you might want a thin pair of glasses that brings your distance eye up to up close to help you get those two eyes in the same plane. So that's what most people choose to do to maximize their freedom from glasses. On the other hand, I have some patients who really are focused on getting the distance vision as sharp as it can possibly be, and they don't mind wearing some reading glasses for up close or for intermediate. So some people choose to have both eyes set for full distance correction and not do any offset, and then just use readers for up close and for intermediate. So there's great options that can really meet any visual demand and give you the outcome that you're looking for, and really just give you that maximum freedom from glasses and contacts, and help you to do what you want to do with that freedom and independence.